All right, welcome back. This video is going to be the lower appendage. I will cover the disarticulated os coxa with the bones of the lower of the leg. If I can get my hands on an articulated pelvic girdle, I will try to do a video of that. If not, I will cover the details of that during lab time. So here is what we call an os coxa, which is basically hip bone. So here's the lateral view. So you can tell it's a lateral view because there's the big socket that the hip bone is going to go into. And then there's the medial view. And a clue that this is the medial view is because we have this kind of bumpy looking articular surface, which is going to articulate with this sacrum. All right. So I'm going to start with, on the bone list, this area right here, the os coxa. I won't be able to do the full pelvic girdle, but I'll get through all of this stuff here before we jump into the femur and the rest of the leg bones. So first of all, we need to identify there's three regions to an os coxa. They're the ilium, the ischium, and the pubis. So the ilium is the biggest part, and it's the anterior part here. So this wingy flat part that I'm holding, right? So this is the ilium. And then if we look anteriorly, this is the front of the pubis, or front of the os coxa called the pubis. It's kind of this pointy part here. And then the back side is this big rough kind of bump here. This is the ischium. So we have the ischium, the pubis, and the ilium. So those are the three kind of regions, if you will, of the os coxa. It is one bone, but it started off as three ossification centers in fetal development that fuse into one bone. So we just kind of break down all the markings based on what part of those three regions you're going to find it. So we're going to start with the ilium. It's the biggest and it has the most markings to it. So the first one is called the iliac fossa. So if we turn it over to that kind of posterior view or medial view, it's this big smooth dent, right? So we should be knowing and getting comfortable now that fossa means dent. So this is your iliac fossa. Okay. Then from there, from the fossa, kind of heading towards the pubis, we have this ridge right here, and this is called the arcuate line. Arcuate line. Right? And then the very top of the bone is called the iliac crest. Okay, so this ridge here, iliac crest. And then we have four spines, and they're named based on their directionality and their position. So if we were to see this, this would be like the front half, the half of one hip bone. So this is anterior, and this is the top. So this bump right here is called the anterior superior iliac spine. And then this one right here is the anterior inferior iliac spine. So kind of follow the iliac crest, anterior superior iliac spine, down to the next bump is the anterior inferior iliac spine. And then if we look on the back side, we can kind of see a couple more bumps here. And so that since this is the posterior side, because here's going to be where your sacrum is going to hook in, this is the posterior superior iliac spine and the posterior inferior iliac spine. So these are the four spines. And you can kind of think of them, they make like a rainbow, right? So you have your iliac crest at the top, and then from anterior superior to posterior, and then anterior inferior to posterior inferior. So that's on that view. If we wanted to turn it around, we could also see those spines. So here's your anterior, superior, and inferior, posterior, superior, and inferior. Lots of syllables with those. Okay, so then now that I have a position this way, that leads us right into the next two markings on the ilium. So this big groove right here is called the greater sciatic notch. And then we have the lesser sciatic notch. Oh, that's on the ischium. Yeah, I kind of jumped ahead a little bit. But here's our two ischial notches. Greater sciatic notch, lesser sciatic notch with this ischial marking kind of dividing the two. And then lastly here, this is called the acetabulum. This is the socket that the femur is going to fit into. So if I grab the femur real quick, you can see that articulation. So it fits very nicely in there. the head of the femur fits into that acetabulum. Okay, so those are all the markings of the ilium. So then we move on to the ischium, kind of the posterior part of the bone. And I've already kind of sneak previewed the lesser sciatic notch. And this bump here that separates the greater sciatic notch from the lesser sciatic notch is called the ischial spine. Greater sciatic notch. And then we have that rough and bumpy area here is your ischial tuberosities. Sometimes this is called the sit down bone, because if you're sitting down, this is what you're sitting on. So that is how your butt is oriented right now, is you are sitting on the ischial tuberosity. Okay. And then lastly, the big hole right here, we're associating that with the ischium, even though it does kind of connect to all three parts. But this is called the obturator or the obturator foramen. Big hole means foramen, right? So obturator. Okay. And then the last part of your os coxa is the pubis. So we have a couple ramus. Ramus means branch. So if this is the bulk of the ramus, superior is just this branch here. Inferior is this branch here. So it just kind of bounds two sides of the obturator foramen. So superior pubic ramus, inferior pubic ramus. And then the last one is called the pubic symphysis, which I can't show you because I don't have a full articulated pelvic girdle, but it's going to be that little wedge of fibrocartilage that sits between two articulated pelvic bones. Pubic symphysis. It is a symphysis joint, right? A cartilaginous amphiarthroses. Right? All right, so those are all of the markings of an os coxa. I'm going to skip ahead of the things that are on the articulated pelvic girdle because I can't talk about those since I don't have one here. And then I'm going to go ahead and go over the markings of your lower appendages. So we're going to start with the femur. Huge. I don't know if it'll fit on my screen. Maybe if I zoom out a little bit, you can see the whole thing. Yeah. So here is the anterior view of the femur. This is a right femur. And I'll talk about more about the left and rights as well in person, because that's a lot easier to do than on a video. Because I need to actually show it compared to my body. So here's the anterior view. It's nice and smooth and nice and round part on the diaphysis. And on the back side, you'll see it's a lot rougher. So that kind of helps to identify anterior and posterior. And then also on the posterior side, on the distal end, you see this really big notch. Okay. And so that is a good clue that you're looking at the back side, because the anterior surface is not going to really see that notch, and you have that articular surface for the patella. Okay, so let's start working through the markings. So head kind of goes into the acetabulum, neck, really obvious here. Shaft, you already identified that, that's diaphysis. And then we have these two really big bumps on this proximal end. So this is the greater trochanter, and trochanters are only found in the femur. Where you find tubercles and tuberosities on various bones, we only are going to find the trochanters on the femur. So greater trochanter is bigger and it's more superior. Lesser trochanter is smaller and inferior on the bone. On that back side, this is our linea aspera. Right? Linea aspera, we're going to have a lot of muscle attachments to the linea aspera. And then we get down to the condyles or epicondyles. So if you remember, the condylar surfaces are the smooth articular surfaces for articulating with other bones. So epicondyles are the bumps just above it. So these bumps right here. So if we look at our bone, the head is our clue that this is the medial surface, because that's going to be pointing medially towards your os coxa into the acetabulum. So if we come down here, the same side, that's going to be our medial epicondyle, this bump here, which makes this bump our lateral epicondyle. So there's a view of it there from that view, and there's a view of it there. Okay, medial and lateral epicondyles. Okay, patella. I do have a patella here. So let me grab that real quick. My bone pile. Tiny little thing. So here's the patella. This would be sitting, this is the superior surface, and this is the inferior surface, kind of the point. It's called the apex, even though that's not on your list. But what is on your list are the facets, okay? So we have these big facets here. There's one here, and then there's one here. The facets are those articular surfaces that articulate with the femur. So you can kind of see how they match up really nicely like that. So if we look at our femur, right, so there's the medial end. I'm just going to run it right here. So that means that this side here is the medial facet, and the larger of the two is the lateral facet, right? So that's our patella. Oops, a little bit. Okay, next we have our lower leg bone. So I'm going to cover, I froze. It kind of works sometimes, and then it kind of doesn't work. So let's keep trying this again. Yep. Okay, so here we have our tibia. So this is the larger of the two lower leg bones. And it has a good articular surfaces. These are condyles. These are called the medial and lateral condyles because that's what's going to articulate with the condyles of the femur, just like that, okay? Now, for this particular bone, to try to find the medial and lateral surfaces so you can identify the condyles, you have this bump down here we're going to learn on the distal end. This is called the medial malleolus. Okay, so if we find this medial malleolus, we know that that is the medial side. So if we come up to our condyles, then that's the medial condyle and that's the lateral condyle. So medial and lateral. But you might be wondering, well, how come those ones are called condyles and the other ones were called epicondyles? Because if you remember, epi was above. So we had epicondyles on the femur because they were above the condyles, and we had epicondyles on the humerus because they were above the condyles. The condyles are the actual surfaces of articulation. Epicondyles are more for muscle attachment, right? And then the next thing on the marking is these little ridges right here. Here's a condyle, here's a condyle. So this little ridgy part in the middle is called the intercondylar eminence. Intercondylar eminence, okay? And then on this part, this is the anterior surface of the bone, posterior surface of the bone. There's like a big kind of dent right here. On the anterior surface, you have this nice big bump, and this is called your tibial tuberosity, right? Tibial tuberosity. And then this very kind of almost sharp ridge line. If you've ever scraped your shin bone, that's what you scraped, or at least the skin that overlies it. This is called the anterior crest. Sometimes it's called the anterior margin. Sometimes it's called the anterior border. Any of those terms are fine. We call it the anterior crest or border, but sometimes you see margin as well. And then lastly, here's that medial malleolus, the distal end here. Okay, so there is the tibia. Now, the fibula that I have is bent. It would not normally be like this because if I try to articulate it with my tibia, it won't fit. And it's not really flexible. Our bones at school are more flexible. But I'll still go over the articulation of this to identify left and right in person during lab time. But the only marking on this bone is the distal end. This whole distal end is called the lateral malleolus. So if I did articulate it, the distal end, it would look something like this. Okay, so the lateral malleolus fits into this little groove right opposite the medial malleolus. So what we actually see are both the malleoluses extending a little bit down because the ankle joint is going to be right there. So if I grab the foot from my bone pile here, we can see how those malleoluses kind of make a nice little cradle for that one of the tarsals there of the foot bone. All right, so those are your lower leg bones. We have the tibia is a larger and medial of the two. Your fibula is the thinner, smaller lateral of the two. with this lateral malleolus. Okay, so then that leads to our foot, which is very similar to our hand. It's got a collection of tarsals instead of carpals. It's got our foot bones, which are called metatarsals instead of metacarpals. And it has phalanges. And they're all numbered exactly the same as on your hand. So that's a good repetition, so it's not like learning a whole bunch of new bone names. So we'll go over the tarsals. So the biggest of the tarsal is the calcaneus. So this is your heel bone. So if you remember the calcaneus area or body landmark, calcaneal region, is because this is your big heel bone. And then the bone we just saw articulate with the tibia and fibula, this is the talus. It's got this nice round dome shape here. Okay, so that's your talus. Okay, so those are the two biggest bones. And then the next kind of largest bones are these guys right here. This more skinny kind of rectangular looking one is called the navicular. And then the more square one is called the cuboid because it looks like a big cube. Okay. And then that leaves just these three. They're called the cuneiform bones. And if you identify this, since this is the middle part of the foot, this is the medial surface of the foot, we have medial cuneiform, intermediate cuneiform, and lateral cuneiform right next to the cuboid. And then, because this is our big toe, we have metatarsals 1, 2, 3, 4, 5, and phalanges, proximal distal phalanx number 1, proximal middle distal number 2, proximal middle distal number 3, proximal middle distal number 4, proximal middle distal number 5. And that's it. We made it through the leg. Okay, so I will see you for another video.